Good morning. My name is Bob Jones. I'm the President and CEO of Children's Aid and Family Services. I want to welcome all of you to the 8th Annual Tree of Addiction Conference presented by the Center for Alcohol and Drug Resources, which is a program of Children's Aid and Family Services. I want to take a couple of moments to share a little bit about the Center for Alcohol and Drug Resources. It's one of our most important programs. The center is committed to prevention of alcohol and drug misuse, as well as recovery support and services. We work with individuals, families, schools, and the community. The center's programs have served probably over 100,000 citizens in Bergen County since our founding in 1979. During the pandemic in 2020, the center helped over 5,600 people with prevention and recovery services. The center now also provides a virtual service, which was established recently, and it's a new 24/7 helpline. This hotline is available to anyone suffering from the disease of addiction, as well as to their loved ones, family members, and anyone who's deeply concerned about someone who's struggling with addiction. More than about 90,000 drug overdose deaths occurred in the United States in the last 12 months, or at least ending in May of 2020. That's the highest number of overdose drugs ever recorded in a 12-month period. There are over 1,700 overdoses, not all of them fatal, recorded in Bergen County during that same period. The tragedy of these deaths and the prevention and recovery services needed to prevent such tragedies from continuing to occur is really at the heart of our work at the center and the purpose of this conference as well. In light of these numbers and with the goal of protecting young people in the communities, the center's prevention services are expanding. A new issue has been addressing the legalization of cannabis, the legislation involved for those that are over 21, and its impact on those younger than 21 and their families. The center, through its EPIC Youth Peer Leadership Program, created an educational campaign about cannabis that will be shared with schools and on social media to inform young people about the impact of cannabis and the fact that it's still illegal for them to be using it. The legalization of cannabis is confusing. It's a confusing issue for parents very much. Even though the dispensaries are only open for adults 21 and over, schools are encountering many kids who are using. The center recently launched a program for school counselors, nurses, and parents to refer kids to a program we call CHAT, which stands for Creating Healthy Attitudes Around Teens. The program works to help teens examine the reason why they use, the perceived benefits associated with their use, as well as the impact their use has on their life and those around them. It offers them the opportunity to consider making changes in their use and strategies on how to help them do so. The services provided at the center have been significantly enhanced by the leadership of our next speaker, Bergen County Prosecutor Mark Musella. The prosecutor's office has been an exceptional support to us and a partner throughout our journey. His office is spearheading many community outreach efforts. The prosecutor has shown real leadership in addressing substance abuse and addiction in our communities. It was the prosecutor who launched the 24/7 hotline so Bergen County residents can connect to addiction and recovery support services. It's my pleasure to introduce to you Prosecutor Mark Musella.
Good morning. My name is Mark Musella, and I have the honor of serving as Bergen County's prosecutor. Thank you to the Center for Alcohol and Drug Resources for organizing today's event and for inviting me to be here. It is my honor to speak alongside friends and to be part of an event that promotes awareness, prevention, and education, but also celebrates recovery and hope. I'm also honored to speak on behalf of law enforcement and to share with you some of the great work that the 3,000 law enforcement officers in Bergen County are doing every day. Since 2014, all police officers in Bergen County have carried Narcan, and last year alone, they deployed Narcan 324 times. That's nearly every day. There were more than 600 overdoses in Bergen County last year, and more than 145 of them were fatal. These numbers matter because they show us that this problem is not going away, and we need to do more. What can we do? In law enforcement, we are partnering with the Center to connect individuals struggling with addiction to treatment wherever we have the opportunity. That is at arrest, in jail, in court, and through a 24/7 hotline that is answered by the Center and funded by my office through grant funding from the Attorney General's office. What can you do? Talk about it. Talk to your doctor if you're prescribed an opioid. Make sure that you are educated about the risks. Since 2015, detectives from our narcotics task force have been visiting Bergen County schools doing a presentation called Pathways to Addiction. In this presentation, they talk about the two main pathways that we see: an opioid prescription after an injury or wisdom teeth removal, or experimentation with substances like alcohol, marijuana, or pills. Talk to your friends and family about the importance of safe medication disposal. If you have used opioids in your medicine cabinet, they are never appropriate to share or take later for a different injury or unrelated pain. Check to see whether your police department has a drop box. Talk to your children and loved ones about the importance of wellness, health, and self-care. Thank you to all of the agencies that work with us formally and informally in prevention, intervention, and diversion. In addition to our partnership with the Center, the Bergen County Office of Alcohol and Drug Dependency, Bergen Newbridge Medical Center, Alumni in Recovery, the Black Poster Project, New Jersey Reentry, New Jersey Recovery Advocates, Transition Professionals, and others. It is also my honor today to introduce someone who is not just a community partner and the leader of one of our key partner agencies in the Center, but also a friend, Ellen Elias. Ellen Elias's core strength is her ability to forge alliances and leverage stakeholder and critical resources to address urgent public health needs and create models for systemic change. To that end, Ellen led a county-wide effort to build a peer recovery support services system, resulting in innovative and sustainable partnerships between law enforcement, government, and healthcare service providers. She also spearheaded a research study to assess the behavioral health needs of female inmates in a county jail, which led to the creation of a drug rehabilitation program for women. It remains in existence to this day. Ellen is a valuable member of the Children's Aid and Family Services executive team as Senior VP of Prevention and Community Services. Her role is to assist in the development of the agency's strategic vision and oversee the diverse team of the Center for Alcohol and Drug Resources and the menu of services that operationalize that vision. She is also an adjunct professor at Ramapo College of New Jersey, where she provides undergraduate students with an introduction to the field of prevention, addiction, and recovery support services. Ellen is a graduate of NYU's master's program in counseling, is a certified prevention specialist, and is a thought leader on a variety of state and county committees.
Sorry about that. One of the lessons again. Thank you, Prosecutor Musella, for your warm welcome. I just want you all to know that I am not as old as my bio makes me sound. But seriously, Prosecutor Musella, we, and I mean the collective we, are enormously grateful for your leadership in Bergen County. The partnership and collaboration that we have with the Bergen County's Prosecutor's Office on both prevention and recovery support initiatives is literally changing lives, one at a time. Again, thank you and the entire Bergen County Prosecutor's Office team. Bergen County is better because of you and your office. I want to thank all of you for being here today at today's conference. We're thrilled that you've joined us. for the 8th Annual Tree of Addiction Conference this year. And last year, when we had our virtual conference, we never imagined that we would have another one this year, but here we are. And we can only hope that next year's conference will be back in person and we'll be able to be with each other again. It's really going to be a wonderful morning and I'm super excited about it. Before anything, I want to thank the entire Center for Alcohol and Drug Resources team for making today's conference a reality. They've done an incredible job bringing this conference and the community together in this virtual way. Bob spoke about two major areas of the center's work: prevention and recovery support. Our mission is to help those we work with reach their fullest potential, be self-directed in their life with a focus on wellness. I believe that this is a shared mission among all of us. The connection we have as a community is the glue that helps us to help others. By working together, we accomplish more than any of us could possibly do on our own. And isn't it that aspect of connection that helps those who are suffering begin to heal? Clearly, the past year and a half has had a toll on all of us and on the world around us, and it's been enormous. There have been so many lessons learned during this time. One of the most important lessons learned is the need to give ourselves and give each other some grace and forgiveness. And we need to have a willingness to be open to new ideas and new ways of doing things. The ways we did things in the past may continue to work for some, but not for all. We've been able to connect with each other locally, statewide, and nationally in ways that we hadn't done before, with more opportunities for us to learn from and with each other. There was an article that was released on October 27th from Health and Human Services Secretary Becerra, which summarized where we need to go as a country to change the tide of overdoses and overdose death. The report identified 4 specific areas that are part of our focus and that must be part of our focus. They're prevention, harm reduction, treatment, and recovery support. There's a recognition that we must have this full continuum of care, that we must reach historically underserved communities, and we must fund harm reduction and recovery support services that initially grew organically from grassroots efforts and were not typically funded. And looking at this continuum underscores the fact that our working together in partnership is essential to make a difference. We have a great day ahead of us. We have a wonderful keynote presentation and workshops. However, before I introduce our keynote